First of all, I would like to welcome everyone on this session on challenges of assuring welfare and quality of life in the aging populations. I'm very pleased to be here and discuss this topic today, particularly as case is mostly recognized on its macroeconomic research and generally economic research, while we have been doing at case for a number of years now studies on social protection policies, and today's session is for a reflection of that. We will have three wonderful speakers. Let me introduce our speakers as they will appear with presentations today. Mr. Bernhard Ebenhaus, who is a professor of social policy and the former head of the Department of Social Policy and Intervention at the Oxford University. He's also senior research fellow of Green Templeton College and associate member of Nuffield College. Good morning. Our second speaker is Agnieszka Chłoń-Domińczak. She's a professor at Warsaw School of Economics and the head of the Institute of Statistics and Demography. She's also a former deputy Minister of Labor and Social Policy in Poland. She supervises the SURE study in Poland, and we'll be very happy to see today some of the very fresh results on the labor market participation of older people in Europe based on the SURE survey. Good morning, Agnieszka. And we have a third speaker, Mr. Hans Dubois, who is a research manager in the Social Policies Unit at the Eurofound. His research areas include healthcare, long-term care, social benefits, retirement, and housing and local area quality. At the moment, Hans is finalizing a report on the impact of the pandemic on older people's lives. That's the very new research. It will be published spring next year, and we are very happy to see some of the results on access to services today. Before joining Eurofound, Hans was an assistant professor at Koźmiński University in Warsaw. As I already said, today we will begin with three presentations, and then we will have discussion. So I would encourage everyone who is online or here with us today to ask questions. If you're online, if you write questions on chat, I will simply see them and ask them on your behalf. Yesterday and today, earlier, there was a lot of discussion on inequalities and different aspects of inequalities of income, of power, of opportunities. With the first presentation, Bernhard Ebenhaus will discuss social implications of pension reforms in terms of inequality and the risk of poverty. Professor Ebbinghaus, the floor is yours.
Yeah, thank you very much. Thank you for the invitation, and it's a pleasure to speak at this 30th anniversary case. As was just said, I'm going to talk about the social consequences of pension reforms in aging Europe. I'm going to look at, on the one hand, how pension reforms were aiming at later retirement age, and also the problems with that kind of strategy on the one hand, and then that pension reforms and the pension systems also have now a tendency, of course, risk at least, to increase poverty and to some degree also translate inequalities from the labor market into inequalities for older people. So let's start with the next slide. We all know about the need for pension reforms in aging Europe, the demographic challenges to aging societies, but that's something that really all European countries are facing more or less, given the demographics of an aging society. Now, part of pension policies is, of course, a large part of the welfare state, of the social expenditures. It's in many countries nearly half of the social transfers of the social expenditure. Part of that was also due to the fact that there was a trend towards early exit, early retirement. And that's really a contradiction in a way, that we have longer life expectancy, but ever earlier retirement. We have this trend since the 1980s with the mass unemployment. Now, since the 1990s, we see in all European countries a trend towards welfare reforms, and pensions was really on the agenda. And one of the measures, of course, or many of the measures that were taken were really to push back early retirement, phasing out these pathways and options in terms of going on retirement at an earlier stage, increasing and equalizing retirement age in the pension systems, but also other ways of retiring earlier, increasing longer contributions periods that are needed for a full pension. In addition, there had been the shift towards private funded pension in Eastern Europe, often mandatory funded pensions, which also include, of course, an incentive to work longer. Contributions period matters. And the same kind of logic also was introduced in many pension systems through demographic factors, notional defined contribution reforms like in Italy or in Sweden. Now, generally, even more in terms of we have just heard about labor market developments. There has been a general shift, of course, in policies beyond pensions in terms of active aging, increasing lifelong learning. And this is part, of course, of the EU's policies to increase the employment more generally across Europe. And over time, this has already been part of earlier targets. Now, the 2030 target, you can see on the slide, but also an increase in training opportunities and a consideration that poverty, of course, is still a big problem in Europe for working age people, but also in old age, and a pledge to reduce poverty. Now, on the next slide, we will see that employment rates, that initial aim of 2010 to increase the employment rate for older workers 55 to 64, so before the traditional retirement age, was successful to the degree that all countries in Europe have increased their employment rates for this older age group. Yet we see also big differences. Nordic countries, the Baltics, and also Germany have really had either traditionally already relatively high level, or like Germany, really advanced the employment rate. And yet some of the Southern European countries and Eastern European countries, including Poland, are lagging behind that. They have just made basically the threshold that was set in 2010 in terms of 50%. And you can see also that particularly women are retiring probably earlier. And in addition, this measure is, of course, a crude measure because many of those are actually in partial retirement, so they may be only in part-time, they may be in secondary jobs. And in a way, this is also not, of course, including those older people that are searching for employment and are unemployed. So we see the general trend, but also the kind of differences across countries, across Europe, in terms of how far they have achieved this goal. So on the next slide, I'll show you very briefly a kind of a sociological analysis, because there are, of course, some of the limitations in terms of increasing retirement. If we analyze those that are basically forced to retire early, that is often because of disability, health reasons, or because they were dismissed, mass dismissal of companies closing down, and so on. So they had not really much of a choice. And this happens usually 2-3 years earlier than the average worker. In addition, we see that actually, if we ask people about would you have liked to work a bit longer, there are some that say, yes, I would have liked to work longer, but that's usually on average about a year longer than was the case in their retirement. So there are also some restrictions and limitations, of course, in terms of moving all people up in terms of a later retirement age, which is required maybe for more financial reasons, for sustainability reasons. On the next slide, I will now introduce more the topic in terms of the logics of pension systems and their poverty and inequality goals. I think on the one hand, we have in Europe, if we take it very, very crude, two basic philosophies of pension systems. We have a more social insurance systems going back to Germany, Bismarckian tradition. Also many Eastern European countries have still maintained a kind of a social insurance logic. And you have the kind of Bavarian, Nordic, basic pension logic, where then there's in addition a more private pillars and tiers to the system. Now, there are two concerns. On the one hand, poverty, and poverty would mean that really it matters in the basic pension systems how generous they are, whether they lift people above the poverty line, which is, for example, not the case in the UK. So basic pension has increased, but is not yet enough on that. In social insurance systems, like also in Poland, it really matters very much on some of their social assistance targeted benefits, but also particularly on the minimum pension you get if you have your minimum contributions, so the social pension that is paid. On top of that, what you can see here in the income distribution is really that in social insurance systems, the logic was always there was an earnings-related part to the pension. Therefore, it translates, of course, market inequalities through the contributory system into old age inequalities. The kind of achievement model was the basis for that. In Bavarian system, the state kind of often stays out of that. It's much more up to the market forces, private pension systems, arrangements by employers. And that creates, of course, lots of inequalities in terms of access to these systems, contributory pensions, and so on. And redistributive elements in these systems, in the social insurance systems, are somewhat easier to, because there are state systems through, for example, for times of long-term care, child periods, that there are some credits in the contributions or for periods of unemployment. And this does not happen as such in the more privatized systems, in those multipillar systems. So this is the basic systems difference and also the two dimensions that we will look at in the next slide, more as how it maps out across countries. So on the one hand, you find here on the horizontal, from left to right, low poverty to, on the right-hand side, high poverty, and inequality, how that is translated into old age inequality from the top, low inequality to the bottom, high inequality. And we find a group of countries that does relatively well in terms of low inequalities and low poverties, and that's the Nordic countries, but also some of the Central and Eastern European Visegrad countries that you see here on the very left. Poland is somewhere in the middle, not because of inequality, that has been already, that's relatively low, because also, the last 30, 40 years of working life where there were less inequalities. But poverty seems to be for Poland a bigger problem than for some of its neighbors, immediate neighbors. And it's also a major problem for some of the big players, countries, Germany, the UK, and in the meantime also for Sweden, that has had some reforms that increased more the contributory principles. And you see some really countries of the more newer EU members, countries in the periphery that really have a high problem of high poverty across Europe, beyond the average, and also inequalities that are already there in the labor market and translate into inequalities in old age. So we see from this map certainly that poverty, old age poverty, is already in some European countries a big challenge, and it will become even a bigger challenge probably in the future, given the consequences of some of the reforms, and particularly for those that cannot work as long as it is necessary to get a full pension. Let's go to my concluding slide, the last slide. Thank you. So we see different logics in these systems between social insurance and a more multi-pillar systems. I think poverty is really, of course, the main poverty reduction is the main aim of basic pension systems. Yet we see the differences really, it depends on the generosity of these systems. So Nordic countries, the Netherlands, doing much better than, for example, the United Kingdom. And on the social insurance side, the whole logic of the system is really reproducing inequalities in the labor market, also in old age. That's maybe less of a problem so far in Eastern European countries, given that the initial market inequalities, at least for those core countries in the East, have not been so high. Yet the state then in these social insurance systems can use some redistributive elements, and particularly it's important, for example, for women to have some credits for carriers and reduce the inequalities in terms of gender differences. In terms of the state pension, we have also learned through the financial market crisis, as well as again now with the pandemic, that the pension systems are really a stabilizer during the crisis. They are able to at least maintain the income for the older population vis-a-vis the working age population. Now, in the social insurance countries, private funded pensions have been advanced since the 1990s. In Western Europe, more on a voluntary basis. In Eastern Europe, more on a mandatory basis. But many of these schemes are not yet really mature. So they are not yet a large part of the story of inequalities or also in terms of poverty for those countries. And that's a very different story on the side of the already existing beverage and multi-pillar pension systems. So that's the UK, for example, the Nordic countries, Switzerland, and the Netherlands, where the multi-pillar systems, really the private funded pensions, has a large role to play, where it really depends, however, on the coverage and the earnings capacities of people, how this is translating then into their retirement income. In terms of the financial crisis, of course, in the moment of the financial crisis, you have negative returns on your capital. So that's a challenge. You might have to postpone your retirement for some years to really gain again, have more further saving, increase your savings. And therefore, I think particularly in the multi-pillar systems, the state may not be so much involved in terms of expenditure, but needs, of course, to regulate private pensions, particularly in terms of coverage of these systems, and also governance and prudent investment, particularly given the experiences of the financial crisis. So my main message here is, I think that generally pension reforms have been going on in a concern of the financial sustainability of these schemes, but we need to rethink, on the one hand, our ability to increase the retirement age in the future, and on the other hand, also the social consequences in terms of inequalities and poverties that come with the particular features of these pension systems. Thank you for your attention.
Thank you very much. I think there are several particularly interesting points, at least from my point of view. First of all, on the reproduction of inequality from earlier life, earlier work life into the pension period. And secondly, on the differences in the risk of poverty and inequality in older age between countries, particularly as some of the Eastern European countries will face larger risks. You also said that in times of crisis, like COVID crisis, pension systems tend to protect older people from poverty. But the question is then, how will it work in the future if older workers faced some uncertainties during the pandemic, and how long will they last? And this question brings us to the second presentation. Agnieszka, the floor is yours.
Okay, I'm
here.
It
works now. Yes, you're
now?
Here with us. Thank you.
Oh, great, wonderful. Thanks very much. So, as Agnieszka mentioned in the beginning, we are a part of a shared team at the Warsaw School of Economics. So I thought it would be very interesting to present some of the results of our analysis of how the COVID shock, how the COVID pandemic affected the situation of people 50 plus, because with the functioning of the pension systems, we also need to sort of understand how the current developments affect the well-being of older people. So on the next slide, there is information that the pandemic had impact on the conditions of work, risk of job loss, and also worsening economic situation, which were all non-intended consequences of stringency measures introduced by countries. And I wanted to shortly elaborate on all these measures. So on the next slide, first I will explain the survey. So after the outbreak of the COVID pandemic, the shared team, international European shared team or international shared team, decided to conduct a telephone survey among the panel respondents, so that we could actually see what happens to the share respondents during the first wave of the pandemic. And on the next slide, there is some context that is important, as many of the consequences that people 50 plus face because of the pandemic is related not to the extent of the incidences of the illness, but also the stringency of the policies that were introduced. And here's the depiction of how stringent the policies were, roughly during the time of fieldwork that we had between countries. So as you can see, in the southern countries, in the Western Europe, the policies were more strict compared to, for example, Eastern European countries, which may have affected some of the results. As you will see, for example, France was a country with relatively strict policies, which we need to take into account while analyzing the the current situation of people 50 plus on the labor market and also their economic situation. So on the next slide, you will see the breaks in employment that were reported among the share respondents divided by gender. And interestingly, we'll see that there are huge differences. So, for example, in Poland, there were relatively fewer breaks in employment and people were continuing working, even if it was in different conditions, while in countries such as, for example, Italy, France, or Switzerland, the incidence of breaks were much faster, were much bigger. Okay, and on the next slide, we also see differences in how, again, people 50 plus worked during the pandemic. So majority of people actually worked in most of the countries, worked at their usual workplace. However, again, we see that there's a huge group of people, there's a significant group of people who worked at home only, varying again from country to country. So again, looking at Poland, this is a relatively smaller share. However, in Belgium, Italy, or France, a large share of people worked from home or combined it with working from home with working from the usual workplace. So again, what we see is that the COVID pandemic affected the way people worked, and that can have an impact on other things like organization of work and family life. People 50 plus frequently also engage in the childcare of particularly their grandchildren because of the situation that they faced. Okay, and then on the next slide, what is also important to underline is that the risk of job loss or of people 55, 64, of people that are compared to the people in the working age really depends on the country situation. So it's not that people in those countries when people were losing jobs to more or less the same extent it affected people 50 plus, and in those countries where the labor market reacted relatively better, and this was amongst others Poland, we didn't see drop in employment neither in the entire working population as it was discussed during the previous panel, as well as with the other part of the working force. And on the next slide, we also have information about the job loss amongst the share respondents. And here I would like again to refer to the first graph with the stringency policies. As you can see, France or southern countries, that is the countries that had more stringent policies, experienced higher risk of job loss among the share respondents compared to the eastern countries that again the job losses were not that large. This is among share respondents, so these values differ slightly from the labor force survey data. And on the next slide, I would also like to show that what happens on the labor market is not the only problem that people faced. We also looked at the economic difficulties that people had. And as you can see, the sort of gradient changes. So in Eastern countries, we see definitely more people that reported that they face difficulties to make ends meet. And if I can refer to the previous presentation, we see that indeed in the countries that have problems with the poverty of older people, this problem of making ends meet really becomes an issue, especially during the pandemic. And on the next slide, I also wanted to show that amongst the people who experience difficulties to make ends meet, some of them decide to dig into savings as one of the ways to deal with the economic difficulties. And this kind of policy or this kind of behavior again is more observed in countries where such savings exist. So in countries where we have either third pillars, occupational savings, or in general larger savings amongst households. However, this kind of behavior can lead to the risk of, for example, lower savings at the old age and worsening long-term situation of people who decided to dip into their savings. On the next slide, it is a summary of our results on who actually faced the most difficulties. So the job losses were more visible amongst people with lower educational attainment in relatively younger age group in our respondent sample, that is those between 50 and 54. Difficulties to make ends meet were in the households of people that live alone or a larger household, 3 or more people, compared to households with 2 people living there. Again, lower educational attainment. We also see that those who are already on pensions have less risk of facing difficulties compared to employed, which again shows that pension systems actually protect people from larger difficulties. And labor income is less risky during the times of a shock that affects the labor market. Difficulties were also, by the same token, experienced by people who were younger than 65 years of age, and also those that faced economic difficulties earlier, 2 years before in the previous wave of share. So that shows that poverty or economic difficulties amongst older people is not a short-term phenomenon. For many people, it is an ongoing development that affects from their previous life courses, their overall economic situation that they have. And again, as you could see on the graph, and that was also confirmed in the model, that Central, Eastern, and Southern European countries had faced more difficulties here. We also see that people with higher human development index that measures both economic and social development, people in those countries were more resilient to economic difficulties. They seem to have more chances to deal with the short-term economic stress, for example, by using their savings. So it is very important to think about the way pension systems, the way pension savings are also promoted as a sort of resort in such situation. However, the future pension rights should be also monitored in such situation. And I think that's all. We have the next slide.
Thank you very much, Agnieszka. I think it's very interesting to see how the situation of older workers and older people in general, including pensioners, has changed during the pandemic. When we discuss aging, we think first on financial independence. We think of the ability to extend working lives, but crucial elements of aging policies are related to access to services. And this is the topic that I have asked Hans to discuss today on how access to healthcare and long-term care services has changed during the pandemic. Hans, the floor is yours.
Yes, thank you. And being part of a European Union organization, I will, of course, highlight the EU policy context here, which is on the next slide, and in particular the European pillar of social rights, which gives the rights to everybody in the EU to access healthcare and long-term care. So next slide, please. So indeed, progress, that's already from the Stiglitz report, so beyond GDP and beyond, progress is not only measured in employment, income, GDP, but in also other aspects of quality of life. And the crisis, the pandemic, has really put one of these outcomes at the center, and that's mental well-being. So you see that during the pandemic, that many older people and younger people, and you see the most impact on the extremes of the age spectrum, so youngest adults and oldest adults, report worse mental health conditions, often triggered by reduction of social interaction, also bereavement, in particular for older people, of relatives or people close to them. Now, also self-reported health has already a few months into the pandemic, it's deteriorated for many older people, partly related to a clear reduction of physical activity, but also reduced access to healthcare, and that's what I will come back to later. Next slide, please. Now, on the other hand, the crisis, the pandemic, has also triggered many support initiatives with regard to mental well-being. A lot of phone lines providing support were very quickly established, also providing help with groceries, medicine, etc. And maybe more systematically, a lot of initiatives have been taken by municipalities in particular to contact systematically all older people who were not in contact already with municipal services. And for instance, in Romania, it had a particular long-term objective of providing a long-term, there were EU funds involved in this, and a longer-term support plan for these people. So many municipalities reached out to people they would not have reached out otherwise to. Then also a lot of support has come from children, actually most support, people's children. So that poses a big problem for people without children. Next slide, please. And let's move to healthcare. Now, when you look at healthcare usage during the pandemic, you see that actually many people, most people, the yellow dots, but many people in the first place have used healthcare during the pandemic, and actually most of it was face-to-face with the GP. However, you see a very large increase in low-tech, so over the phone usually, e-healthcare, so remote healthcare. And you see that it almost tripled compared to before the pandemic. And it even became very common in countries where e-healthcare was really rare, like in Belgium. Okay, next slide, please. Now, of course, there have also been, as before the pandemic, there were a lot of unmet medical needs as well, and they increased dramatically during the crisis. In particular, because on top of the usual reasons for unmet needs were two new reasons, or even more, but two main reasons, and that was the unavailability of healthcare services and the fear of catching the virus. However, if you look at how it is evolved during the pandemic, we see in our Eurofound's e-survey that towards the end of the pandemic, these reasons became a bit less important, and the old traditional reasons like waiting list, even though now caused also due to the backlog caused by the pandemic, but also lack of reachability, unaffordability became very dominant reasons. Again, they increased largely. Okay, next slide, please. Now let's move to long-term care. Overall, there's many gaps in access to long-term care already before the pandemic. So here we show a graph which shows that, in particular for home care, which is in particular policy focused, like enabling people to stay at home as long as possible. There's really a clear distinction between countries with the bottom half GDP countries and the top half GDP countries. Now, while there's some diversity in the top half GDP countries, in the bottom half GDP countries, you clearly see that there's very little home care services provided. So there are a lot of unmet needs, but also some needs are met, but by informal care, by relatives or friends. So when you compare the number of formal long-term care workers with that of informal frequent carers, you see that the latter is really enormous. 44 million informal carers in Europe. Next slide, please. Now, during the pandemic, home care was very often temporarily restricted in the countries where it was available. And to the most urgent cases, and others were sometimes followed up by phone, sometimes not. And also residential care at reduced capacity. And on top of that, many people were afraid of using all these services because of the situation in care homes, but also with many deaths concentrated there, but also the fear of catching COVID when using home care. And so there's been many unmet needs also during the pandemic. And the pandemic also has triggered shifts in care provision. So for instance, from residential care to home care, but also negatively impacted quality in some cases. And importantly, even if there were not so much changes in the amount of informal care in some countries, you see that the intensity has increased. So for instance, in Ireland, 77% of people caring for somebody with dementia said their workload has increased during the crisis. Now, one issue which I also wanted to highlight is domestic care. And this is so long-term care provided by carers employed by the household. And this is really common in 7 member states, among them Austria and Germany, where there are many carers coming from neighboring countries with lower incomes, like in Germany, Poland, in Austria, Slovakia. So these are very often on 2-week shifts, for instance, so going back to their home country and then coming again. And you see that because this is trans-border care, the pandemic has impacted that largely. So the European Commission facilitated this care. So they issued a rule that these essential workers, including elderly care workers, could cross borders easily. However, many of these workers don't have a contract. So they were not so easy for them to cross the borders. And where they did have a contract, so for instance in Austria, they needed to work close to the border, and many of these care workers do not. So Italy, interestingly, can be highlighted here. There was a lot of undeclared work in domestic care here, but they used the pandemic to regularize this. So pandemic support was only available to those who regularized this care. Now, I'm highlighting this because in several countries there seem to be increases, like in Poland as well. When the incomes are increasing, aging societies, there's more and more domestic carers from Ukraine actually coming to Poland. So it may be an issue for the future. Okay, next slide, please. Now, I looked with regard to access to these care services, I emphasized these unmet needs. Now, this is partly because there's data available from EU Silk, so European-wide data, also our own data and share data, but access problems go beyond unmet needs alone. First of all, people may actually be able to access care, but they have problems in doing that. So, for instance, and also if they may get the care, but not the care they need precisely. So you have, in terms of long-term care, there's often limited flexibility, often hard to combine informal and formal care. There is, in healthcare, many people during the beginning of the pandemics run into arrears, so they had payment problems. So they could get the care, but they could not pay their bills. So later this became more unaffordability problems. So they transferred into unmet needs, but in the beginning they were not. And also with regard to e-healthcare, yes, many people obtained e-healthcare, but there were problems. So first of all, yes, in terms of unmet needs, because people had different difficulties accessing these ICT tools, but also, for instance, heavier forms of care were really hard to do over the phone or over internet, like research shows on psychiatric care in Finland, for instance. Also, primary care often did not fulfill the role in guiding people through the healthcare system as it did otherwise. It's also rare to have screen-to-screen care, which used to be mandatory in France and has been stimulated in Estonia, for instance, because this is usually associated with better quality care, etc. So next slide, please. Now, lastly, I wanted to highlight also that care provision focused here on care received by older people, but older people also provide a lot of care. This informal, so it's unpaid work, basically. In terms of informal care, you see during the pandemic, yes, women still provide more informal care to grandchildren, elderly relatives than men, but there was a larger increase among men, in particular in terms of grandchild care. With regard to pandemic measures, well, again, Italy, interestingly to highlight, there was an informal childcare allowance established, and suddenly it became very clear that many people provide this informal care, with over 1 million people requesting it, and actually most of them were older people 60 and over. Okay, next slide, please. Besides informal care, also a lot of formal care is provided by older people. So health and long-term care sectors are growing sectors, like long-term care by 1/3 over just in 1 decade it has grown. And they're persistently female sectors. That hasn't changed in the very dynamic sector otherwise. But many are unable to work until the retirement. And by the way, in this graph, you see that compared to long-term care, compared to the other sectors, there's a very large proportion of people aged 50 and over working there. And this has also increased much faster than in other sectors. So, for instance, you have policies which try to extend working life. Germany explicitly tried to have care workers longer working or getting back to work by making earning income besides your pension more attractive for them. But if you don't improve working conditions, that may not have so much impact, because many people report to be unable to work until the retirement age. So what you need to do is, okay, there's low pay on the one hand, but also exposure to adverse social behavior at work, lifting and moving people, and having little say on your work arrangements. And there's ways to address these issues. Okay, next slide, please. Now, to finalize with some ideas for policy pointers, okay, we said that both actually for long-term care and healthcare, many people did not seek this care because they were afraid of catching COVID. So you can say, well, that's a decision of the people themselves. But these people are afraid the institutions, so the public transport taking them to healthcare, or the healthcare providers themselves don't protect them well enough against the virus. So it's also trust in institutions. If you strengthen that, then you can guarantee that people seek healthcare when they need it. Another point I wanted to highlight is that, yes, the crisis highlighted the importance of social interactions and mental health. So a first reaction may be invest in mental health care services. Yes, that's important, but it's also important to look at the causes of mental health problems. So in the previous crisis, 2007-8, yes, there were also many people having mental health problems, but many because of job loss. So providing these jobs may be equally important to providing mental health services. Well, here as well, address social isolation, address job and income insecurity, physical social aspects of working conditions, and try to prevent them. Also try to make access to care more resilient. We see that access to care become increasingly, in particular healthcare, increasingly dependent on income and employment through complementary insurances. And now this has a risk. So there has been a large decrease on unmet need since the previous crisis, the recovery. However, we see that very quickly during the beginning of the crisis, problems emerge. So as soon as people cannot afford it, they lose their access to healthcare. That can be different, as seen in some countries which where access is less dependent on income, like Spain, Austria, for instance. Okay, next slide, please. So the EU has the Work-Life Directive, trying to have some formal rights to workers to provide informal care. However, many informal carers are over the pension age. They're not working anymore, and they face also challenges in terms of social exclusion and health. So it's important to improve the non-care life balance for them as well, not only for people in employment. For instance, by improving access to respite care. Another point I wanted to highlight was about domestic care workers. So yes, you can a lot of the measures taken during the pandemic were more focused on ensuring continuity of care, not in improving the conditions and the quality of care, the conditions of the workers and the quality of care of those who receive the care. So on the one hand, you can regularize this and with some rules, which Austria did pretty effectively. But maybe better is to, from an early stage, guarantee high-quality, flexible, long-term care services, which we see as in many of the other countries. There are only 7 countries where domestic care is really common, but in none of the Nordic countries, Netherlands, Ireland, it's not common. You can prevent this precarious way of care provision by providing good quality long-term care through a public system, or that can be privately provided, but at least some entitlements which can be checked. Then also we tend to look at care services, our organization and me as well, but when you try to address care needs, but actually many things can be addressed by making home improvements and improvements to the local area. And the crisis, interestingly, confined people to their homes and to their local areas in many countries. So people got a snapshot in what their lives will look like when they get old, as many people in the EU will experience soon. So if you improve housing conditions in neighborhoods, you can also enable people to stay longer at home, not only through care, but also through the social, physical, and yes, also service dimensions of the neighborhood, for instance. Okay, thank you.
Thank you very much, Hans, for this very interesting presentation. I think now we have a quite complex picture of the situation of older people. The first question that comes to my mind, which sort of links together all we heard today, is has the pandemic and the crisis related to financial uncertainties, to care obligation, which were largely shifted to family, care for children, care for elderly as well, has this had an impact on retirement decisions? For example, entering retirement early, particularly as these policies of shifting retirement age seem not always be socially accepted. Maybe we'll start with Bernhard.
Yes, during the pandemic, I haven't seen the data yet about that, but I would guess that for some older people, given also the particular health risks, that they have been withdrawing from the labor market, basically, in the case where they weren't really in an occupation where you could work from home, and so if they got unemployed, if maybe after furlough they didn't really return to their career job. So in these cases, probably people have been kind of forced through the circumstances to retire earlier. And as I said in my presentation, this might mean different things. So in a system where you depend very much on a public state pension, it really depends a bit on, is there still are your pension benefits really cut severely by retiring in 1 year earlier or 2 years earlier. With the more privatized funded systems, of course, again, then it depends. During the crisis, you have particularly problems because also the financial markets, the returns on your savings might be not the best time to retire. So I think that might work out differently across countries. But certainly, I think the shared data set will be one of the data sets where we are going to look into, what kind of consequences that had for the retirement decisions.
Agnieszka?
Yes, I fully agree. I mean, we have the second wave of the CATI survey that we just collected the results, and I think it will be interesting because with the first wave, these were just a few months after the pandemic outbreak, so we couldn't see the behaviors yet. And again, I think it will be very mixed because it indeed overlaps, as Bernhard said, with the policies that exist. So if there's an overall policy of increasing retirement ages, that mainly wasn't changed during the pandemic times. However, what we see in the data a little bit is that, for example, people who combined receiving pensions and still some employment, they resigned from employment. So if they have a stable income, they decide that they reduce their working activity, presumably. These were older people, so presumably because of the risk. Being afraid of being exposed to various risks related to the COVID pandemic. And again, I think it is important also to look at the, say, generational and family perspectives. For example, if young people in the family have difficulties with finding a job or they lost a job during the pandemic, it may also actually force their older parents or encourage their older parents to remain in employment despite the risks. So the entire sort of intergenerational context may also affect the decisions. So it will be very interesting to look what happens. Pension reforms definitely are the factor that in general works towards prolonging working lives, even despite the shocks. The policies don't change with retirement age reductions, not to mention a few countries, but the changes in Poland were before COVID. So also the fact that we have, let's say, larger inflows to retirement are rather the results of the earlier policies, not exactly the COVID itself.
Thank you, Agnieszka. Hans, Eurofound survey had several waves. Was it possible to observe some changes over time regarding retirement decisions or decisions to stay in the labor market?
So I can tell you, I wanted to highlight two things here. So our survey did not ask explicitly about retirement surveys, but or about retirement intentions and so on. But we did map national evidence through our network of European correspondents. We asked for national evidence on this issue, for instance. We got some mixed evidence, but for instance, in the Netherlands, we clearly see that more people were retiring, some other countries. Also, interestingly, I think we were a bit puzzled by the gender impact, as was shown also in the earlier slides by Agnieszka, about job loss. I think there you see that it's kind of mixed. We were expecting that many more women would have been impacted by this crisis. Well, it's clearly more gender balanced impact of the crisis than the previous crisis, where there was mostly men directly impacted. But here, actually, we didn't clearly find what we were expecting. But then we went back to, for instance, Portugal, and we asked, why is it that more men became unemployed during this crisis? We weren't expecting this with more women being employed in tourism, etc. So it was they looked for us more carefully into the data and found that actually, yes, unemployment didn't increase, but more older women entered in inactivity, in retirement. So that's certainly part of the explanation. Cyprus, they had the explicit measure. So everybody was entitled to support if they would lose their job temporarily during the crisis or fully, except for people aged not yet at the pension age, which is 65, but at 63, because it was said, well, they have this option to retire early, they can withdraw a pension. The only thing is that if they do that, they get cut in their future pension dramatically. So they were forced to do that. And then something important I wanted to highlight lastly, what we did ask in our survey was about working hours. And when you look at employment data, employment is usually already if somebody is only 1 hour in the week being employed. So that gives a bit biased picture. So there, younger people are much more affected than older people. You see a stabilization of employment rates in 2019, 2020, which has been increasing over the past, or flattening down. But for younger people, it went down. Now the picture will be different, but that was the first impact. But if you look at working hours, it's the opposite. Older people were more likely to face reduced working hours. So it's important not only to look at job loss, employment, but also unemployment, but also at working hours. And we see this in particularly among workers aged 65 and over, which are mostly can explain by self-employment, and many self-employed faced reduced working hours, also among younger people, but more among older people, partly because there's more self-employment among older people. And a group which, that may not be the largest group, but a particular interesting group to highlight is the people, which we did research about before, people who are combining work with pensions. You see there in particular among that group, there's been a large reduction of work in this group. So yes, some earlier retirement decisions, but also important to look at these reduced working hours.
So I wonder, what are the most effective tools to keep people in the labor market? Because the policies, let's say for the past 15 years or even longer, concentrated on extending working lives. In some countries like Northern European, this has actually succeeded. In other countries like Poland or Lithuania, older people tend to withdraw from the labor market, saying that, work is too demanding, either physically or mentally. I think COVID created another pressure due to the need for digital skills. So I wonder where the pension policy should go now. Is flexible employment in older age a solution? Are financial incentives to stay in the labor market and postpone retirement age, entering retirement? Is this successful, like it's done in Germany? What would be your ideas on that? Agnieszka?
Thank you. Our earlier analysis of the shared data indicated that focusing on the quality of the working conditions, especially for people 50 plus, is very important, because there are many issues that sort of either keep people on the labor market or push people out of the employment, including the way including the organization of work, whether it is flexible or more rigid, which is or not fully in line with the preferences of people 50 plus, whether people feel appreciated with their competence and skills in the team, which is multi-aged team, if they feel that they have chances of employment progression, whether they feel that their earnings are adequate, but also if they perform a heavy work, or that they feel sort of recognized by their supervisors. And our analysis showed that in countries where workers are more satisfied, 50 plus workers are more satisfied, employment rates are indeed high. So, of course, it's very difficult to say what is the causality. If it is because people have better quality of and better satisfaction, they stay longer on the labor market, or it is a deliberate policy in order to keep people on the labor market. But nevertheless, it is very important to think about also this kind of work conditions and work atmosphere, as well as other issues that are related to, again, reconciliation of work and family life. You mentioned care responsibilities, which relate both to older family members, to children in countries when there are more care services, both towards older people or adults requiring support, as well as children. This may also a factor that reduces this kind of a pressure to retire as early as possible in order to take care of the family members. So it is a very complex mix of policies, and we see that indeed in countries that are succeeding in having more older people in employment, it is a mixture of such policies, which is important. In Poland, in Lithuania, we still particularly lack this kind of feeling of satisfaction on the labor market, and workers are very frequently not only, dissatisfied, or they feel sort of tired with the routine of the work, and because of that, they want to retire as soon as possible.
Thank you. I recall that a couple of years ago, Eurofound did a research on, it was a midterm review, recognizing the needs of all the workers and preparing companies to satisfy these needs and enable, for example, combining work and care, or investing in health of workers, or work environment. Is there a Eurofund research on that, or flexible employment?
Yes, that's right. And adjusting jobs, and so we did a lot of research on that. But like your question, if financial incentives work, yes, they do definitely. The only problem is that if you, so we also recently did a research on partial retirement schemes. So people could reduce a bit their hours closer to their preferences or to their needs, because they could not work full hours anymore, and receive a bit of pension to compensate that, and are then later reduced a little bit on their pensions. So if you get these incentives right, you could facilitate work for people who cannot work the full hours anymore. So for people with health problems, for instance. However, in practice, we have not found a scheme which really were able to reach this group of people. We see in general that people who continue working are those with the better off, basically, often, and it kind of amplifies inequalities very often. To address that, indeed, I agree totally that it's important to address the working conditions, indeed, of the older people, but also it's important to start early on. Also younger people. And one issue I could highlight here which is often overlooked, are the mental health issues at work. There's sectors which may not have the typical physical problems from previous decades, but more mental health-related issues, mental well-being issues, are increasing in size. And long-term care and healthcare workforce is just one example there. So you need to address these issues as well. So, and in the recent report on the long-term care workforce, we give some measures which could contribute to that. But one important one is to have more staffing. That would certainly help, which is a problem because there's already shortages now, which is kind of a vicious circle. If you don't improve the working conditions, there will be shortages. And then it's hard to improve the working conditions. So.
Thank you. Still, I would go back to the question on effective policies to Bernhard. How would you say, what are the possible most effective policies given different welfare regimes, given different pension models that you described earlier?
Well, I think one of the challenges is in a way that we make policies, be it pension reforms, then really with only the view of how can we change the financial incentives for later retirement, while at the same time you need to have also a training policy, you need to have a labor market policies and so on at the same time. So I think, for example, one of the things that were just said about mental health, many of the reforms were about in the past in terms of reversing early retirement, were to make disability pensions more conditional and maybe also less generous. Right? For example, the Netherlands is a good case there. There were these schemes had a very large number of people on them, and so there were lots of political pressure to change that. And I think to some degree, we make pension policy for the ordinary standard pensioner, but we also need to, for example, think about, is the disability pension right for those, particularly those cohorts and occupations where physical or mental health are a particular issue. So I think, it's not just pension policy as such, it's a whole range of policies from disability health-related issues to training and what to do about labor market integration, and how can we find, even for someone who is maybe 50 plus, a second job if they are unemployed and so on. So there is a whole net of things, including also the partial retirement that theoretically would be a good way of extending retirement age, but in practice is so conditional too of so many other factors that needs to be right. And moreover, in some of my earlier work on early retirement, it's also a question not only about politicians doing the right kind of things, it's also a question about collective bargaining partners, workplace level decisions that are being taken. So we need also the social partners to be part of that kind of strategy. And so that's quite a coordination problem in a way across ministries and down to even the workplace level.
That is a very good remark, but how can we cope with the challenge that I think Hans showed? We know that all the workers, all the people need more care, they need improved access to healthcare, simply to be able to function in everyday life. And yet, during the pandemic, we faced a huge healthcare crisis, and people were not able to use healthcare. The level of unmet healthcare needs, which was actually lowering over the past 15 years, has dramatically grown up. Would you have ideas coming from either Eurofound study, share study, or some countries' experiences? How can we cope with such a high level of unmet healthcare needs? Hans, can we start with you?
So that's, I think on the longer term also, there's a big role for prevention. and that's often so. There's at the moment there's a lot of additional budgets going into healthcare. It's to be seen if that will be spent wisely, and if indeed these budgets will be allocated. So that's to be seen. But in general, it's not just a question of allocating budgets. It's also, as we've seen in some, some of the Eastern European countries, in specifically, that there was a lot of European budgets going into getting the facilities, the equipment right, but there was kind of people forgot a bit about the human resource part. So you need to have doctors, nurses, and you also have the patient side. They need to be able to afford and get to the healthcare facility. So it's important to address access on all these dimensions, and not just on one, like better equipment, better hospitals, etc. So that's one thing. Also the prevention side, it's important to highlight. There's a lot of preventable diseases, and in particular, for the longer run, it's really, really important to invest more in prevention. And a lot can come from housing, local area, but also working conditions. So investing in better working conditions, it's not just to keep people longer in employment, it's also to better quality of life, but also to reduce expenditure on healthcare and long-term care, because people will need it later if they have had healthier lives. So I think in the longer term, and that's important, there's a risk of all these funds coming available that you only look at the short-run messages, the healthcare system as such, but at the longer run, you also need to look at prevention. But yes, we identify clearly in some countries you have different problems in terms of reachability. In others, it's affordability of healthcare is the problem. And of course, these need to be addressed at first. And also in terms of long-term care, in some countries, you already have hardly any access to long-term care. And so there's a different question. But even in the countries with access to long-term care, you have large quality problems, large problems in that it's not flexible enough. People don't get the care they need. So it's really country specific, but there's broad dimensions here where you should address these problems.
You address a very important issue of migration. We observed also in Austria, in Germany, that the pandemic has changed the situation of migration, particularly care migrants. But migration seems to be an important solution to human resources problems, also in Poland during the pandemic in the healthcare system. But it's also quite important given the pension systems with shrinking working age population. Agnieszka, do you have with share data some ideas about the migration as well?
No, with migration not, but a little bit to the use of health services. What we also looked in share is the use of e-medicine or various kinds of online contacts. And indeed, it seems to be something that replaces at least some of the healthcare contacts and healthcare access, especially in countries in Central and Eastern Europe. I'm sorry. So I think that we will have the new norm with more of having this kind of non-personal contacts also in the area of healthcare, which can help to sort of reduce some of the problems related to, let's say relatively simple contacts related, to continuing prescriptions and I'm sorry, regular contacts with the doctors. What we also see in the second wave of share, which we start to analyze, is that some of the foregone visits are sort of being done between the first and the second wave of the survey. So in the past year, indeed, the initially postponed visits in many of the countries were actually conducted. So that means that after the initial shock, some of the healthcare sector really returned to, let's say, more or less fulfilling the regular activities, which is, I think, a good outcome of what we see in the data.
And I wonder also how is the quality because of e-healthcare. Do either Eurofound or shared data show any? Do they show what's the quality? How is it evaluated? Hans, I can
Yes,
point.
So that's a big issue when you look at e-healthcare. It's very quickly, it's about the proportion of people who received it, etc. But there's very little really known about satisfaction, the quality of the care, and what we did was we mapped national evidence here. So we asked all the national contact points we have about results in their country. We're at the moment analyzing the data, or the information from that. I think a general point can be made that e-healthcare or e-long-term care, because in long-term care it's much less developed than in healthcare, and you can question whether it really has large potential or not for long-term care. But some was replaced during the pandemic by telephone calls just to follow up. But the heavier forms of care, that's a general conclusion I think you can take. Heavier forms of care, there's really limited what you can do through with good quality through e-healthcare. And in particular, so for instance, with mental healthcare, yes, it works for light cases. It seems to work, but for heavier cases of mental healthcare, you need this face-to-face care, and that's and so it's important to, alongside developing e-healthcare, which is indeed facilitating access for some, it is important to also, alongside, keep providing this face-to-face access to very good level, in particular for these heavier forms of care.
Thank you very much. I just had a look at the timing, and I think we reached the end of this session. Thank you very much for a very fruitful discussion and wonderful presentations. Thank you to all guests who are online and to those who are with me here in Warsaw. And I invite everyone to lunch break.